Kira, would you mind to come back to the esophagus? So we're going to do it as structured as possible, and I'm just going to quickly introduce the case. It's a 53-year-old man with an incidental finding of a duodenal polyp, but the man is in workup for heart transplantation. So yeah, he has an ICD, so he is a bit comorbid, but still relatively young. And I would like you to start at the esophagus and do it systematically, Fakira. So we do a careful introduction, and we did not really inspect the oropharynx yet, I think. I think definitely in patients pre-transplant, we need to look at everything possible. We want to exclude any possible malignancy. That's why they get their gastroscopy and colonoscopy. And given that we are here in a training course trying to get you structured, so we don't have to teach structure to anybody anymore who leaves this course, we would like you to show it very nicely. So here we are in the oropharynx. We definitely want a photo here. You got some mucus here, something definitely to aspirate when you have a patient who's not sedated or not intubated, because otherwise this drops onto the vocal cords, causes them to cough, makes the procedure harder for them and for yourself. So, and then we gently go down under view. So it's usually not pushing, but gentle talk. And if a patient's awake, you can ask them to swallow, often helps. But sometimes difficult because their throat is anesthetized. And then we slowly go down towards the junction. And we already look for areas. We look for the gross morphology of the look at the gross morphology of the esophagus. We look whether there's like another configuration, deformity, for example, and that you have to do by keeping your scope in the middle of the lumen. And here we're getting at the junction. So for Kira, do we see anything in particular here?
So I think there's just a bit of inflammation perhaps down here. A bit of erosion there possibly. It's an irregular Z line, I would say, but I don't think there's any Barrett's or anything concerning with it.